Lyme disease is one of the most common tick-borne illnesses in the world, yet it remains widely misunderstood. From early symptoms to long-term complications, how much do we really know about this disease? Today, we'll break down the science behind Lyme disease, its causes, symptoms, diagnosis, treatment, and prevention, based on the latest medical research and expert recommendations. 1. What is Lyme disease? Lyme disease is caused by the bacterium Borrelia burgdorferi and, less commonly, Borrelia myoni in the US, and Borrelia afzelii and Borrelia garini in Europe and Asia. It's transmitted to humans through the bite of infected black-legged ticks, Ixodes scapularis in the US, Ixodes ricinus in Europe. According to the CDC, around 476,000 people are diagnosed and treated for Lyme disease annually in the US alone. High-risk areas include the Northeast, Midwest, and parts of Europe and Asia. 2. Symptoms of Lyme disease. Lyme disease. Symptoms occur in stages and can vary widely. The early stage, 3 to 30 days after a tick bite, often includes erythema migrans, EM, rash. A bullseye rash occurs in 70 to 80% of cases. Fever, chills, fatigue, muscle aches. If untreated, the infection can spread, leading to more severe symptoms weeks to months later. Neurological issues, facial palsy, meningitis. Arthritis, especially in knees. Heart palpitations, Lyme carditis. Some patients develop post-treatment Lyme disease syndrome, PTLDS, with persistent fatigue, pain, and cognitive difficulties, though the exact cause remains under study. 3. How is Lyme disease diagnosed? Diagnosis is based on symptoms, exposure risk, and lab tests. The CDC recommends a two-step blood testing process. 1. ELISA test screens for antibodies. 2. Western blot confirms the diagnosis. Early testing can be unreliable since antibodies take weeks to develop. Some experts also use PCR tests to detect bacterial DNA. 4. Treatment options. The primary treatment for Lyme disease is antibiotics. The choice depends on the stage. Early stage, doxycycline, amoxicillin, or cefuroxime for 10 to 21 days. Late stage or neurological symptoms, intravenous antibiotics like ceftriaxone. Most patients recover fully with early treatment, but delayed therapy can lead to complications. Alternative treatments without scientific backing, like long-term antibiotics, are not recommended by major health organizations due to risks and lack of evidence. 5. Prevention and tick safety. Preventing tick bites is the best way to avoid Lyme disease. Here's how. Use EPA-approved repellents, DEET, picaridin. Wear long sleeves and pants in wooded areas. Perform tick checks after outdoor activities. Remove ticks properly with fine-tipped tweezers. Pro tip: showering within 2 hours of being outdoors reduces tick attachment risk. 6. Controversies and misconceptions. Lyme disease is surrounded by controversy, especially regarding chronic Lyme, a term not recognized by the CDC or WHO. While some patients report lingering symptoms, scientific studies show no evidence of persistent infection after proper antibiotic treatment. Research continues into PTLDS and autoimmune responses. Conclusion: Lyme disease is a serious but manageable condition. Early detection and proper treatment are key. If you've been bitten by a tick or experience symptoms, consult a doctor, stay informed, stay protected, and enjoy the outdoors safely.